Dhaka in the 1930s was a burgeoning city of 120,000 people, mostly living in and around the present Old Town along the Buriganga River. A major city in East Bengal under the British Raj, Dhaka was growing in importance due to rapid socio-economic and political changes. The economy was based on trading mostly jute, cotton, tea and spices based on riverine communication. The gentry comprised of officers of the Raj, educationists, professionals, businessmen and aristocrats who mixed well socially. A group of 17 people met at a meeting held in the Imperial Bank of India, building opposite Victoria Park, now Bahadur Shah Park, on December 22, 1937, and founded the Rotary Club of Dhaka, the first club in the then East Bengal, and now Bangladesh. The meeting was chaired by H.R. Wilkinson, the charter president of the club, and attended by the following charter members: H.R. Wilkinson, R.C. Mozumdar, S.K. Chatterjee, A.K. Das, S.J.E. Virgo, P.C. Ghosh, S.A. Salim, S.K. Basu, J.C. Das, W.J. Berry, Altaf Hussain, J.W.A. Pheasant, Drive N. Gupta, Dr. P.C. Chakrabarti, H.J. Makartik, Dr. Mahmud Hassan, and Dr. J.C. Ghosh. The club was chartered on February 26, 1938. Admitting it to the Rotary International, the largest international organization of volunteers serving humanity, was founded in the industrial city of Chicago of USA on February 23, 1905. Paul Percival Harris, an attorney, and three of his business acquaintances, Gustavus Laurie, Sylvester Schale, and Hiram Shorey, gathered at Lohr's office in room 711 of the Unity Building in downtown Chicago for a meeting with an idea that businesses and professional people could join together in fellowship and service to the community. This is the first Rotary Club meeting. Rotary Club of Calcutta, the first Rotary Club in mainland Asia, founded on September 26, 1919, presented the charter on March 22, 1938, as the sponsoring club. Rotary Club of Dhaka has implemented hundreds of projects and programs for service to society, changing hundreds and thousands of lives. Community service, an important avenue of Rotary service, is the hallmark of all Rotary activities of the club. Major projects and programs. The Rotary Primary School was founded in 1951 in Rajabazar in Tejgaon. The school was handed over to the local government, now Dhaka North City Corporation, in 1955. The school is the oldest project in Bangladesh, now running as Rotary Government Primary School. The Rotary Blind School in Tejgaon, the first of its kind, was founded in 1956-57. It has been the nucleus for the government's Drishti Prothabandhi Bidaloy under the Jatio Prothabandhi Unnoyan Foundation. The club responded immediately to the cyclonic storm Great Bola cyclone that struck the coastal areas of Bola and Pachuakali on November 22, 1970. It was the world's worst natural disaster in history. A unique seminar with Rotary International was organized, which attracted worldwide Rotary response in launching the project Home for the Homeless with financial assistance from World Community Service, WCS, program of Rotary and foreign Rotary clubs. In 1972-73, the club rehabilitated a large number of people affected by the 1970 cyclone in Char fashion and built for school-cum cyclone shelters at Galachipa, in Pachuakali, with prefabricated steel structures, donated by Rotary Clubs of Japan. From 1978 to 1999, the club organized Walkathon program, and Terry Fox run jointly with Canadian High Commission to raise funds for combating cancer. President, Vice President, ministers, dignitaries, diplomats, Rotarians, and celebrities participated in the program. The club signed a Memorandum of Understanding with the government in 1980 and founded the Rotary Cancer Detection Unit, RCDU, in Dhaka Medical College, which is the signature project of the club. In 1982, the government founded the National Institute of Cancer Research and Hospital, NSRH, with RCDU as the nucleus. During 1985-86, the club constructed a permanent three-storied building for NSRH at a cost of 3.5 million taka, raised through the Walkathon program. It was the first building for NICRH. The club supplied lab equipment for NICRH with the support of the Rotary Club of Baldwin, Australia. Over 1 million cancer patients have been treated in the RCDU in the last 41 years. The club organizes awareness programs for the prevention and early detection of cancer and the treatment of cancer patients. In 2017, the club set up the Rotary Center for Immunohistochemistry Testing Facility for ER, PR, and HER2 for breast cancer. Besides, the club provides regular assistance for the treatment of cancer patients. From 1983, the club launched the Sleeping Kits Distribution Program, the longest-running program of the club. The program is funded by a Canadian NGO sleeping children around the world. The project involves the distribution of bed kit consisting of a mat, mosquito net, pillow with case, bed sheet, blanket, clothing items, sleeper, and more. Costing $35 Canadian per kit. Over 100,000 boys and girls in equal numbers from age 5 to 12 from the poorest of society benefited from the program in the last 32 years. Since 1985, the club joined the Rotary International Initiative for the Eradication of Polio from the World, under Polo Plus program. The club played a leading role in the National Immunization Day program, started by the government in 1995 with the initiative of Rotary. Rotarian late PDG Iftikhar Alam was the chairman of the National Committee for Polio Program. The club immunized over 100,000 children from 1995 to 2014, when the country was declared free of polio. In 1996, the club introduced modern teaching methods, the Concentrated Language Encounter Program, under Rotary International's 3H grant program, amounting $500,000. The program was participated by Rotary Clubs of Dhaka and Rotary Club of Footscray, District 9800, and the Rotary Foundation. The program was executed jointly with the Department of Primary Education and covered 555 government and 290 Rotary primary schools in 33 districts of Dhaka and Rajshahi divisions. The mobile clinic Hasuk, on a self-propelled steel boat, was launched in 1997 under Rotary International's matching grant program. It provided medical care, including dental and eye care facilities to 50 to 60 patients every day, covering 68 villages in the marshy areas in Kisharganj area. Rotary volunteer doctors from abroad provided their services in the project. Rotary Club of Dhaka, in 2020 to 2021, has responded robustly to the outbreak of the coronavirus pandemic, the worst health crisis in recent history, resulting in millions of deaths in all parts of the world. The club distributed cooked food, ration, and cash assistance, including PPE, masks, and hand sanitizer, to tens and thousands of men, women, and children, especially among the low-income and vulnerable people. The club set up a RT-PCR SARS-CoV-2 testing laboratory for cancer patients at NICRH. It is the only BSL-2 category corona lab in the government sector. Besides, the club also set up a state-of-art 15-bed HDU unit with a modern treatment facility at Kurmitala General Hospital and enhanced the capacity of Kuwait Bangladesh Matri Hospital in Uttara for the treatment of critical corona patients. Apart from the major projects and programs, the club organizes a large number of programs regularly in keeping with the Rotary's 6 key areas of focus that include basic education and literacy. This club organized literacy programs in slums and rural areas at Rajabazar, Rayur Bazar, Kilgaon, Bata, and Gandaria. Textbooks, writing material, backpack, training aids and manuals including school meals are supplied to schools every year. The club also provides financial assistance to meritorious poor and underprivileged students. Prevention of diseases and treatment. In this, the club organized numerous health centers in and around Dhaka and also in rural areas for free treatment of poor people. In 1961, the first eye camp in the country was organized by the club with the assistance of IPSE and BNSB. Since then, numerous eye and dental camps are organized every year, including school eye examination and Aussie Bangladesh Care for Dental program, supported by a number of hospitals including Islamia Eye Hospital, Bangladesh Eye Hospital, and Donation Society, dental colleges, and a number of NGOs. The club regularly organizes cataract operations for poor and vulnerable people. The club provided food trolleys, wheelchairs, pedal waste bins, and deep freeze and weighing machines to Kumudini Hospital with the assistance of Rotary and Rotaract Clubs of Australia. In 1998, the club provided wheelchairs to Burdam and Dhaka Zoo. The club donated an ambulance, costing Taka $1.3 million, to Matrika Clinic in Mirasarai with the financial assistance of RC Waterville, USA. The club organized heart camps from 1998 to 2001 with the services of the renowned heart surgeon from India Dr. Devi Shetty from India. The HIV/AIDS awareness for students in 1998 to 2002 jointly WHO. In 2007, the Rotary Pacemaker Bank was formed jointly with 4 other Rotary clubs, namely Buriganga, Cosmopolitan, Mid-City, and Dilkasha, and the Heartbeat International, a US-based NGO, and National Heart Foundation. The Aussie Bangla Smile program was launched in 2007 for cleft lip and palate, and burn reconstruction surgery supported by the Rotary Club of Nepean and Penrith of Australia. The club treated 150 patients for prolapse and VVF surgery from 2012 to 15 with the support of volunteer doctors from the DAK Foundation of Australia. In 2014, the club launched the Prosthetic Hand Project, providing active functional hands jointly with LN4 of the USA and CRP of Bangladesh. Maternity and child health. In this, the club has organized a number of Free Friday clinics for mother and child in 1997 to 98 in Loharpul, Aliabazar, Segan-Bajika, Postagala, and Dodkandi area, jointly with the Japan-Bangladesh Friendship Hospital, Association of Medical Doctors of Asia and Rotary Club of Fukuoka, Japan. From 1998 the club provided life-saving medicines to Azimpur Mother and Child Health Training Institute and Hospital for treating pregnant women with childbirth complications. The club undertakes regular vaccination for children against life-threatening diseases, including pneumonia, HIV, jointly with 16 Rotary Clubs of Nagasaki, District 2740, and the Rotary Foundation. Economic and community development. It has been one of the important focus areas of club activities. In 1955 the club built the first passenger shed for bus passengers in Dhaka in front of the press club in Topkana. It was handed over to C&B. Since 1950, the club has been involved in relief and rehabilitation works and disaster management every year, during flooding, cyclones, and other natural disasters. In the 1970s and 1980s, the club rehabilitated hundreds of families with Home for the Homeless program for people affected by tornadoes and floods including Cyclone Sidr in 2007 and Isla in 2009. The club adopted Village Nanduan in Gazipur and Village Ramsara in Jessore as model villages, introducing healthcare and primary education, improvement of homes, job creation with vocational training in agriculture, poultry, and livestock. Tree plantation programs are organized every year. The club jointly with Rotary Voluntary Cornell Monaganj planted over 500,000 trees in 1990. The club in 2006 settled Chand Mia, crippled by polio, by setting up a shop after surgery. The club organizes vocational training for job creation. The club distributed weaving and sewing machines with training in garments making under WCS and other programs. In 1998 the club set up Rotary Computer Training Center for unemployed youth under a matching grant jointly with the Rotary Club of Calcutta and the Rotary Foundation. The club organizes the distribution of winter cloth, blankets, emergency food, and medicines every year, mostly in backward areas. Sanitation and fresh drinking water. The club every year undertakes programs to set up numerous latrines and tube wells for fresh drinking water supply. A pond sand filter was installed in Shamnagar in Satkhera in 2012 for the supply of pure water. The club participated in the program for mitigation of arsenic in the arsenic-affected areas under the Rotary International Initiative, which provided $500,000 in 1999 to 2000. The club organizes school hand washing programs. Peace and conflict prevention/resolution. The club participates in the Rotary Initiative for Peace and Conflict Prevention/resolution. The District Peace Forum Award Program was organized by the club in 2013. The club regularly participates in GSE and Peace Scholarship programs of Rotary International. In spite of the setbacks, the club with the spirit of Rotary has sponsored 24 clubs out of the over 400 Rotary clubs with over 8,000 Rotarians in the 2 Rotary districts in Bangladesh, as the mother of Rotary in Bangladesh. The club has provided leadership beyond the club with 10 district governors. The club has hosted a number of conferences, meetings, assemblies, seminars, and events at international and district levels, with the participation of the presidents, prime ministers, RI presidents, and other national and foreign dignitaries. The first Rotary International Presidential Conference was organized by the club in 2000 with RI President Carlo Ravizza as the chief guest and Professor Dr. M. Yunus as the keynote speaker. The program included a month-long safe blood donation program and collected over 10,000 bags of blood. Also in 2000, the district conference was organized by the club with Prime Minister Sheikh Hasina as the chief guest. The club organized the Rotary Centennial Bell Celebration in 2005, marking 100 years of Rotary. The program was launched by the President of Bangladesh Yazguddin Ahmed from Bangababan. The program participated all Rotarians of Bangladesh, with the bell going around the entire country. The program concluded with a fellowship dinner with RI Director, later RI President, Kalyan Banerjee, as the guest of honor. The club celebrated its Golden Jubilee in 1987, and in 2013 the club celebrated the Platinum Jubilee with Prime Minister Sheikh Hasina as the chief guest and was awarded the Rotary Peace Forum, which was attended by RI past President Bichai Radical. The fellowship programs have been the cornerstone of all service activities. The club holds regular weekly meetings, installation meetings, board and committee meetings, get-togethers including celebrations of various occasions, picnics, and excursions which are participated by members, ANs and LETs, partners and service members, guests, and well-wishers. The club has upheld the sanctity of our great liberation war of 1971 by recognizing the sector's commanders and valiant freedom fighters. The Rotary Club of Dhaka has passed the test of time. The experience of World War II, 1939–45, the Bengal famine in 1943–1944, the Liberation War of 1971, with over 500 members in its 9 decades. The journey through history has been a testament of the Rotary's service above self.